Thursday nights is our healthcare classes and spinal workshops. And tonight we're going to be talking about what is scientific healthcare. And so, first of all, I'm proud of you guys for being here for a talk like this, because there's not a lot of people that will engage in this kind of a conversation, that will even think about this. I mean, because we make enormous assumptions based in our culture. A lot of them are based on marketing and not necessarily fact. And so I'm going to ask you guys, do you think our healthcare is scientific? Or what is it? What do you guys call scientific healthcare? Anybody?
Well, if it's scientific, it'd have to have actual science to back it up, and not just
So what's science?
Peer-reviewed.
some.
So you're saying peer-reviewed literature.
Peer-reviewed literature.
Okay.
Is what I believe in.
Okay. All right.
Which is gold standard.
Okay. We're going to challenge that in just a minute.
Okay.
Which is good. Okay.
That's what
So,
I've been
but
told.
that's a good answer. Has to have a peer-reviewed study behind it. Okay. What is a peer-reviewed study, by the way? Anybody? What is that? We say that. What Ann just said. A good, scientific healthcare should have peer-reviewed studies.
It's a study reviewed by other researchers.
Mm-hmm.
Yeah, by other people that have done research and know something about the topic. Let me ask you this: can peer-reviewed studies be biased?
Yes.
Yes.
Yeah.
Absolutely, they can.
Yeah.
Sure, they can. If all of them are thinking the same way and they can't think outside the box, sure they can. But right now it's the best system we have. All right. So let's get into this. When I was on vacation in Florida 3 weeks ago, I ran across an article, kind of by accident, but it was pretty neat, out of the British Medical Journal called The Illusion of Evidence-Based Medicine. Okay, now, British Medical Journal, one of the top 4 medical journals in the world. Okay, one of the top, most authoritative medical journals, British Medical Journal. Anybody know what the other 3 are?
JAMA.
JMA, yes. My CA knows. JMA, Journal of the American Medical Association.
Hear about.
What other ones? Anybody? New England Journal of Medicine and Lancet. Okay. Now, when I had my radio show and I was doing talks on health every single week, an hour show on health, I was going through these journals like crazy, looking for material, and I got to know, hey, come on in, good to see you. I got to know, I kind of got a lay of the land on what the journal, what they talked about, which ones I liked. And I thought of the 4, the British Medical Journal was by far the most honest, in terms of being objective, was by far the best. JMA, probably, of those 4, the one I like the least, okay? I like British Medical Journal a lot, okay?
Wasn't it the Lancet that published misinformation about COVID and ivermectin in that? Wasn't it?
It's possible, it's very possible. I don't know. I don't know how to answer that question. I think several journals did, okay,
So, yeah.
actually. So let's look at this study out of the British Medical Journal called on evidence-based medicine. It says the advent of evidence-based healthcare was a shift. This happened about probably 30 years ago, 35, 40 years ago, intended to provide a solid scientific foundation for all health disciplines, but especially medicine, okay? The validity of this model depends on reliable data from clinical trials. Most, but not all, but most are conducted by the pharmaceutical industry. Okay? So these are statements right out of that article, lifted right out of the article. Okay. The integrity of science in an open democratic society requires that scientists don't cling to cherried hypotheses and take seriously the outcome of the most stringent experiments. Okay, do you think that always happens in healthcare?
No.
Absolutely not, it doesn't. And we'll talk about that here in a minute. I forgot something in my office. Jason, can you go back to my office and get a book that's sitting on, it's called The Ultimate Placebo, and just bring it in. recently released confidential pharmaceutical industry documents into the public domain, which was forced by the Freedom of Information Act, provided valuable insight into the degree which a drug industry, thank you, that's exactly right, the drug industry has misrepresented their clinical trials. Now, what does that mean? They've misrepresented their clinical trials.
Lied.
They lie. That's exactly right. That's it. They lie, okay? And until this misrepresentation is corrected, evidence-based medicine will remain an illusion. That's a very, very powerful statement coming from one of the most, prestigious medical journals in the world, okay? It says when corporate and financial interests get involved, they significantly have in the pharmaceutical research, the common good, what's beneficial to people, tends to be pushed aside in the interest of the potential of massive profits, okay? Can anybody think of something very recently where this
Vaccines.
may have happened? The vaccine, okay?
Yeah.
Okay, the research, there's a Texas judge, I'm not going to spend a lot of time on this because I actually did a Facebook post on it yesterday,
Yeah, you did.
a video
You'll get
where,
blocked. You'll get in jail.
where a Texas judge forced Pfizer to release their documentation.
That's
They find out Pfizer lied about all kinds of things, all kinds of things.
Yep.
Okay, so you want to pull up my video I did on that. I did that yesterday. You can do this on Facebook. Yeah, assuming they haven't taken it off.
No, it's still there.
Still there?
Yeah, and you can also send it to people, but who aren't on Facebook.
Yeah. Okay.
How is that not fraud though? How are they not?
Well, they're all,
Because they got a lot of money. When you got a lot of money, you got a
Yeah.
lot of influence, and so that's it. That's how it works, Jason.
and nobody's nobody's
It's
taking
the
them to task.
It's the
Yeah.
golden rule. He who has the gold rules.
Yeah.
That's the thing. Okay.
Yep. Exactly.
So, this is Professor Ian Harris, a professor of orthopedic surgery. And this is a book that I read by him a while back called Surgery, the Ultimate Placebo. And what he says there's a lot of procedures and a lot of things done every day in medicine that have absolutely no scientific basis. A lot of it's been proved to be unscientific. People know it and they still do it. Okay? A good book. Okay, now, to be fair to this guy, he's not a big fan of alternative healthcare, and he made that clear in his book. But he does expose a lot of things. I want to read something that he said in here that I thought was fascinating. Okay? This is on breast cancer. He said, chemotherapy can provide marginal survival benefits in patients with solid tumors, such as breast cancer. Now, what does marginal survival benefits mean?
Slight.
Yeah, barely.
Slight.
Barely, yeah. Okay. And he says the same goes for radiation. However, the dosage of chemotherapy and radiotherapy is limited by its toxicity, particularly to the bone marrow.
Yeah.
That's a pretty powerful statement, okay? The British Medical Journal stated that about 4 or 5 years ago. I did a radio show on a lot of that. British Medical Journal had a big expose on that. So not everything, I think there's somebody trying to come in.
Oh,
Thank
I
you. See
didn't.
ya. So not everything that we think is been validated by science necessarily is, and this is one book, if you ever wanted to read this, would really open your eyes to some things. Sure. Now, my goal today is not to bash medicine at all, because they do some really good things too, and there's a lot of good science in medicine. The fact is, I just want you to understand that not everything out there is based on science. Not everything out there that's promoted, that's done, is really scientific, okay? There's a lot of stuff that's not.
In other words, asking questions is a good thing.
Yeah,
No, but
Yeah.
far.
and reading and doing some research. Okay, let's just talk about clinical studies. There's a couple different types of clinical studies. There's two main types. One is observational studies. This is where researchers, you don't do an experiment, but you observe certain things, certain behaviors, certain things, and see if you can set up a hypothesis and prove something. Now, with observational studies, you can't always prove that this causes this, but a lot of times you can prove that something is very closely associated with that. What is probably the most famous observational study ever done? It happened in maybe started in the 60s, 70s, and validated in the 80s. Can anybody remember?
Smoking causes cancer.
Great job. That's exactly right. Good job, Jason. Smoking causes cancer. And yeah, probably one of the best observational studies. What can anybody think of some other really good ones? Just studies that have come out, observational studies. How about diet and weight? Okay, diet and disease. Okay, people's diets leading to certain diseases. Okay, those are observational studies. It's pretty hard to do a double-blind, placebo-controlled study on a diet. Okay, but there's a lot of observational studies, and you see it in biology all the time, like observational studies on lion behavior. Well, you can't do a double-blind study on that, so they're observational studies, but you can get a lot out of that. So that's the first one. The second one is clinical trials. And this is considered the gold standard of research. Clinical trials are very tightly controlled. You have a couple of groups, sometimes at least two, sometimes three, where different groups are exposed to different things, and then you have, and they don't know which one they're exposed to. Then you have the researchers, and in a double-blinded study, the researchers don't know which group got what. Okay, this is considered the gold standard, okay? So, blinded study, the researcher knows who's receiving the real drug. Double-blinded, neither patient nor researcher knows who's getting the real drug. Not everything that we do can be double-blinded. And we'll talk about that in just a minute. There's some really good studies that aren't double-blinded. So, let's just talk about, this is one of the most famous, if this is the first and one of the most famous chiropractic studies ever done. So Windsor autopsies done in 1921. There's a Henry Windsor he was a medical doctor at the University of Pennsylvania. Noticed that a lot of his patients who went to a chiropractor were getting good results. He wanted to find out why. So he did an interesting experiment. He did autopsies. He did autopsies on both humans and animals to see if there was a relationship between the health of the spine and any diseased organs that he found. He did 75 human cadavers and 22 cat cadavers, and he found 221 diseased organs. So what he found was nearly 100% correlation between minor curves of the spine and diseased organs. So I'm not going to go through all of this in detail, but what I'm going to say is this. What he found was that curves and degeneration in the upper part of the spine always correlated to heart and lungs. Curves in the middle of the spine and degeneration in the middle of the spine always correlated to diseases of the GI tract and digestive organs. And he found that curves and degeneration in the lower part of the spine always correlated to diseases in the pelvic organs. And there's 100% correlation. And what he found was this. It was rare to find a diseased organ without a problem in the spine at that level. He also found that once the spine was degenerated, that it caused a diseased organ. It actually caused aging in the person. Okay? So what that means is that the more our spine ages, the faster we age, and the slower our spine ages, the slower we age. That's what he found in these animals, okay? Disease appears to precede old age and then to cause it, okay? So if the spine becomes stiff and the spine begins to degenerate, guess what? Old age follows. So if you keep your spine healthy, according to this observational study, you can stay young. It actually slows down the aging process. So here's another very interesting study, chiropractic adjustments versus disc surgery. This is a randomized clinical trial where they took 40 people and randomized them to, and they were all of these people were considered disc surgery patients. And they wanted to find out if they took people that had been diagnosed and been shuttled off for surgery, if they had chiropractic first, what would happen? So what they did, they all had herniated discs with sciatic pain. And this is published in Journal of Manipulative and Physiological Therapeutics. This is October 2010. And so they wanted to compare the efficacy of surgery against spinal manipulation. This is the first study to compare this, to look at this thing. And they failed other medical type management. So after 3 months of traditional conservative care, painkillers, lifestyle modification, physiotherapy, which is like ultrasound and muscle stim, massage or acupuncture, these 40 patients were randomized to either surgery or chiropractic, all right? Patients were assessed at 3, 6, 12, 24, and 52 weeks after treatment was initiated. At 12 weeks, 60% of the 20 manipulation group demonstrated clear improvements in outcomes and continued to complete the 52-week follow-up period. What that means is out of the 20 patients who were had pretty serious disc problems, when they were adjusted, 60% of them got well. That's not bad. Mm-hmm. Now, the other 40%, they had surgery and they had pretty good outcomes, okay? So this study tells us some really interesting things. First of all, if you have a herniated disc with pain down the leg, that getting chiropractic first is a good option. If chiropractic doesn't work, then surgery may work pretty well, okay? And maybe, now here's something to think about, maybe the reason surgery worked well in these people is because they got chiropractic care. In other words, they had chiropractic care, they went to surgery, their surgical outcome was pretty good, okay? And again, I'm not opposed to surgery when it's necessary, but this is a really, really interesting study. Now here's another study, 2014, University of Iowa, on Medicare patients. And they, again, it's an observational study, and they looked at how well Medicare patients who had chiropractic care functioned. And they found out they had fewer functional limitations, less difficulty engaging in activities such as lifting and walking, and lower number of doctor visits and hospitalizations. Okay, they concluded that chiropractic had a protective, safeguarding effect against physical deterioration. There's another study, chiropractic in pregnancy. 115 pregnant women, they're experiencing back or pelvic pain, and not had any chiropractic care in 3 months, and were not restricted from participation. So they started adjusting these pregnant women. 1 week into treatment, 52% noticed a reduction in pain. 1 month into treatment, 70%. 3 months, 85% were happy with the results. 6 months, 90% noticed a reduction in pain. That's pretty good, okay? So 2 other studies on chiropractic and pregnancy reveal that pregnant women under chiropractic care had half the delivery time compared to women with no chiropractic. Now, why would that be? What caused this? Anybody? What caused that half the delivery time? Why would these women have babies so much easier?
Because things were working right.
Yeah, and what was working right? Yeah. So how does that work?
I don't know. You tell me.
I'm going to. Okay. So does the uterus have a nerve supply? Mm-hmm. Yeah. Mm-hmm. So if the nerve supply of the uterus is intact, the uterus can work right. Okay. Not only that, but you know, the pelvic cavity sits like this. If you have a torquing in that like this, and that's pulling on the uterus, can that uterus work as well? No, it can't, okay? So that's why, that's the reason. They deliver easier, okay? Here's another study, Annals of Internal Medicine. This is now called JAMA Internal Medicine. It's a very good journal. 192 patients with back-related leg pain. That's a pretty good sized study.
Yeah.
Half were given chiropractic care with home exercises and advice. Half were given only home exercises with advice. The chiropractic patients were given 20 visits over 12 weeks. At 12 weeks, the chiropractic group had less back pain, less disability, better overall improvement, and more satisfaction. Again, observational study where you're giving the patients questionnaires and having them fill out before and after. At 1 year, patients who received chiropractic maintain their overall improvement. Here's two recent studies, one in Canada, the other in Tennessee, show that on average, chiropractic care is 40% less costly than medical care, and patients were much more satisfied. Again, this is Journal of Manipulative and Physiological Therapeutics, 2010.
I have a question. The 61% versus 27%, what is that?
This is 61% of the chiropractic patients were satisfied versus 20%, 27% of the medical.
Medical,
Yeah,
interesting.
yeah.
Okay, thank you.
Okay. So again, here's another good study, Archives of Physical Medicine and Rehabilitation. 40 men were diagnosed with degenerative disc disease, and I mean, I see this all the time. Just about everybody that walks in who's over 40 has some of that. Half treated with chiropractic adjustments, half with a placebo adjustment. Okay, so they did a fake adjustment. Okay. Results from the patients who received one adjustment: less pain, increased spinal mobility, had better hip flexion, had measurable increase in height, which I think is interesting. So they actually did a lot of measurements on here, which I think is really important to do, and found out that they did better. How about chiropractic in the workplace? These are two studies, the Journal of Occupation and Environmental Medicine. So 17% of all U.S. workers have absenteeism as a result of musculoskeletal conditions like low back pain, neck pain. It's pretty common. So chiropractic care offered on site at the workplace showed improvement in both pain and functional status, lowering of overall health costs, fewer drugs, less doctor visits, reduced worker absenteeism, and increased employee productivity. Here's one, disc herniation and neck pain radiating into the arm. This study, they took 50 patients, they confirmed cervical disc herniation by MRI, and these patients had moderate to severe arm pain. They were given chiropractic adjustments at 2 to 4 times per week until pain-free. So at 2 weeks, 55% were improved. At 4 weeks, about 69%, and at 3 months, 85.7%. And it says spinal manipulative therapy was 2 to 3 times superior to published studies of patients receiving cervical nerve block with steroids. Now, what's the issue with steroids?
They wear off.
They wear off. That's one. Yeah, that's right. Plus, you got to get it exactly right when you shoot it in there. Otherwise, it doesn't work. You know? By the way, how much is a steroid injection into the spine cost-wise? Anybody know?
A lot, I'm sure.
500?
What?
500.
Probably 50.
$1,500.
Without insurance? Or?
$1,500. Okay. Okay, I know that for a fact. All right.
Oh.
That doesn't count the office visit. That's the injection.
So chiropractic is a lot cheaper than that.
Yeah, it's a lot cheaper, right? I mean, for $1,500, you get a lot of care in my office. Okay, now here's a real interesting study. They looked at biological chemical changes in the body with people that were adjusted, and they found out these biochemicals change for the better with chiropractic care. Neurotension, oxytocin, and cortisol all got better with chiropractic. These are known to suppress pain as well as having other physiological effects. Chiropractic changed those chemicals in the body. Now here's a Medical Science Monitor, February 15th, 2016. This study investigated what happens to an individual when they lose their cervical curve, when their neck goes straight. So we're looking at, this is a curve, this is a loss of curve, okay? This is a reverse curve. So this is what we're looking at. What happens then? Basically, a loss of cervical curve causes decreased blood flow to the brain due to changes in the vertebral artery. That's pretty interesting,
Yeah.
okay? So, chiropractic and migraines, complementary therapies in medicine, April 2015. They looked at 3 groups of migraine sufferers, and they were divided into 3 groups. One group received chiropractic and drugs. One group received a sham adjustment and drugs. One group received drugs only. Study lasted 6 months. Migraine headaches, okay? At 6 months, the manipulation plus drug group were able to reduce their drugs by 80%, their migraines reduced by 97%. Okay? Now, I'm not sure why they kept these people on drugs during this experiment. You know, I don't know why, but they did. Okay? Their functional disability reduced by 100%. The meds plus sham manipulation reduced the drugs by 68%. I think this is really interesting. Their migraines were reduced by 17, and they had a 33% reduction in functional disability. The meds group only had no reduction in medication after 6 months. So what's the difference between this and this?
Somebody's actually getting a.
This is a sham manipulation.
That's placebo.
Placebo manipulation.
Yep.
So
It's
these people really
matter?
these people were only on the only thing that was working for them was drugs as well.
But did they think the chiropractic was working?
Yeah,
Yeah.
it's the placebo
Yeah, because of the
effect.
sham.
Okay, they
that makes
thought they
sense.
were getting an adjustment. That produces a placebo effect
Yeah.
Yes.
in their health, which is that's okay. All right,
It's a
so
start.
the placebo
Wow.
kind of worked
Yeah.
here. Okay,
Interesting.
so Heidi Havoc, she's one of a tremendous researcher in chiropractic. She's got a PhD in human neuroscience. She's published 50 papers on how chiropractic care affects the central nervous system. And what she's found that when you adjust somebody, it actually affects the brain and the frontal cortex. And it helps with balance, reaction times, depth perception, increases muscle fatigue, and loss of muscle strength in legs. It affects all of these in a positive way. Okay? Now, there's a paper that she just came out with that's just right here. And I want to just read you a couple things out of this paper. I didn't make a slide. This is a paper out of a journal. This came out 11 months ago, May of 2021, a journal called Medicina. And it says, the evidence suggesting that chiropractic adjustments there's evidence suggesting that chiropractic adjustments have significant effect on the prefrontal cortex of the brain, which is right here. She said, chiropractic adjustments, vertebral thrusts influence the central nervous system, in particular the prefrontal cortex, which in turn has an impact on the autonomic nervous system, the HPA axis, and the immune system. This provides a biologically plausible mechanism for how chiropractic adjustments, vertebral thrusts, may affect immune function. So when I adjust you, and I'm actually changing your immune system. I'm up-regulating, making your immune system function better. And there's good evidence for that now.
Yeah.
Okay? According to Dr. Havoc, the most interesting thing that's come from her research is that chiropractic care actually changes the way the brain functions. Okay? So even if your pain, even if the progress in your pain is slower than you would like, we're still affecting the way your brain works and the way your immune system works. We're making you healthier, even if the pain doesn't get well as fast as you would like. Dr. Havoc found that a single chiropractic adjustment positively alters all sorts of processing in the brain, in the central nervous system, including how the brain controls muscles, how the brain increases the strength of muscles, and how the brain reduces muscle fatigue, immune and endocrine function. All of that changes when you get adjusted. Now, the last thing I'm going to talk about is the concept of NNT and NNH. I want you to understand this is really important. NNT is called number needed to treat. Now, what that means is in any healthcare situation, whether it's pharmaceuticals, it doesn't matter, how many people do you have to treat with a certain thing before one person benefits? That's the number needed to treat, okay? Anybody in medical research understands this. They know about this. NNH is number needed to harm. How many people will be hurt? How many people do you need to treat before one person is hurt? Okay? So we're going to talk about primarily NNT. So, Nnt of Common Pharmaceuticals is as follows. There's a website that you can go to that will show you this. Statin drugs, the NNT is 1 in 103 over 5 years. That means 103 people have to take statins for 5 years before one person benefits. The other 102 don't get any benefit at all. Okay? Antibiotics for upper respiratory infection, none were help for the infection. 1 in 6 were help for cough. Coronary bypass for preventing death in 10 years, 1 in 25 were help. So 25 people had coronary bypass surgery, 24 did not benefit. Only 1 in 25 did. Aspirin to prevent heart attack, 1 in 2,000. So the other 1,999 people that took aspirin to prevent heart attack did not benefit. So the NNT is 2,000. So I pulled up some information on the vaccines, and I found enough information online to calculate the NNT. So according to statistical calculations that I found available for Pfizer and Moderna, I calculated the NNT for the Pfizer vaccine to be 147. It means 147 people need to be vaccinated before one benefits. Now, would you go to a car repair shop if they had that? No.
No.
Now the Moderna was a little better. It was 91. So I calculated 91 for Moderna, 147. 91 still isn't very good. Okay? That's why so many people are having problems with the vaccine, or they're still getting COVID. Okay? The NNT of chiropractic care is estimated to be 1.8 to 2.4, which is pretty low, which is good. Okay? So, do you understand is anybody that doesn't understand the concept of NNT? Okay? Very important to understand this. Very few people have ever heard of this. Okay? And if you get a good study and you know what you're looking for, you can calculate the NNT pretty easily. Okay? So, how many of you believe now, and I have a lot more studies, but I'm already running over a little bit. How many believe now that there's some pretty good science behind chiropractic? Yeah, there's some pretty good studies that show that it works, okay? And that show that it really profoundly affects a lot of things in the body. Not just pain, but affects brain, immune system, endocrine function. And so, there's a lot of people out there that are in pain, that don't know that chiropractic can help them. That just take drugs and cover up the pain. Drugs that have a high NNT, by the way. So who do you know? I mean, I want you to think about that. Who do you know that doesn't know what you know about chiropractic that could benefit from chiropractic care? Let Carmen know. We'll do a simple subluxation check, and if we can help them, we'll tell them. If we can't, we'll send them to wherever they can get help. But at least they can find out, at least maybe they can get their life changed. So, does anybody have any questions? Ann?
Why then does the medical community kind of poo-poo on chiropractic care? A lot of them.
Because they don't read the studies.
And it's money.
They don't read the literature. They don't care. They don't read these studies.
They don't read anything.
I mean, I'm going to say they don't read anything, but they don't read this. They don't look for this stuff. They
Well, I
don't.
can say that because they didn't look for the facts on COVID.
Yeah, I mean, they don't. If they read, and there's a lot. There's physicians out there that even if they read these studies, they still won't. They still. It doesn't matter.
Mm-hmm.
You know, it doesn't matter. So that's the reason. Is that you know, I collect this stuff. I look for it and collect it. Okay.
There's something wrong with you. You need a life.
Yeah.
We had to go to Florida.
More vacations to
Yeah,
Florida.
I need more Florida. That part's true. Okay. It's definitely true. Okay.
Well, it's also money related.
Yeah, it's related to money.
You know, of course,
Yeah.
they're looking at that almighty dollar thing.
Yeah, I mean, why should they refer to us when, you know, they can make a lot? I mean, why should somebody refer to us when they can make $1,500 off of a shot?
Yeah.
You know, I mean, yeah, there's money. Money's involved a lot. You know, money talks. You know, and so anybody else? Any questions on what I went over? Okay, so in 2 weeks we're going to do one on the brain. How many would like to keep your brains preserved throughout your entire life, to where they work when you get old? Okay, we're going to talk about how to do that
Not
next
to
time.
shrink your brain, yeah.
And what are the things that happen that cause your brain to get smaller? And the reason I did that talk is I kept coming across those articles when I was doing research for my radio show. Kept coming across articles that showed, hey, this shrinks your brain. Hey, this shrinks your brain. And I thought, why not just put them all together and do one talk on how not to shrink your brain? So we're going to do that in 2 weeks, okay? So that'll be a half-hour talk. It's a lot. That one's a lot of fun.
Yeah.
You get a lot of good information out of that. So that in 2 weeks, okay? Great. Thank you all for coming in.